Hi everyone, and thank you so much for joining us online today. My name's Nick, and I'm the Networks and Engagement Manager here at NCVO, and I'll be facilitating today's webinar with the content delivered by our trusted supplier, Zurich Insurance. So over the course of the next hour and a quarter, we're going to be getting to grips with the essential steps when it comes to safeguarding, where we'll cover the fundamentals of safeguarding, how to embed safeguarding practices into daily activities, and where you can obtain additional guidance and support. And so expertly guiding us through the next hour and a quarter will be Alex Cunningham, a safeguarding risk consultant at Zurich. But before I hand over to Alex, there's just a couple of housekeeping points that I wanted to note. So first up, closed captions or subtitles have been enabled, and you can turn these on or off by clicking on the CC icon in the toolbar at the bottom of the screen. In just a moment, my colleague Chanel is going to share the slide deck for today in the chat. So if it would help with accessibility, you can download these to your computer to zoom in and out the slides as we go along. We'll also share the slides in the follow-up email that we sent shortly after the webinar. We're going to be running straight through this morning without a break, and we will have time to take questions in the final 20-30 minutes. So any questions that you've got, please submit them via the Q&A function at the bottom of the screen. Please try to keep your questions as broad as possible so that they're relevant to as many people as possible who are joining us online today. And please don't add questions to the chat as they're likely to get lost there. If there's a lot going on in the chat and you're finding it quite distracting, you can click on the icon at the bottom of the screen, which will close the chat window. Finally, you may have noticed that today's webinar is being recorded, but everyone has joined in view-only mode, which means that only people you'll be able to see and hear will be Alex and I, plus my colleague Chanel, who's producing today's webinar. The recording is going to be uploaded to the NCVO YouTube channel within the next week, so please feel free to share it with your colleagues and across your networks. So, as we've got limited time together this morning, let's get stuck into the content. And to lead us through the webinar on essential steps of safeguarding, I'm pleased to hand over to our expert from Zurich, Alex Cunningham.
Thank you very much, Nick. I will just start to share my slides. Great. Okay. So it's lovely to see so many people on the call today. It's obviously a very complex topic and lots of kind of areas that we could potentially cover off. What we're going to be focusing on today, though, is the kind of essentials. So the kind of a bit of an overview, some thoughts around and some approaches of how to think about safeguarding within different organisations. It is going to be general and you know, obviously your different organizations will have different risks and different activities, but hopefully kind of lots of the information that I've been sharing today will be helpful in some way for you. In terms of kind of the different elements that we'll go through, we will kind of look at safeguarding basics, charity commission expectations, a bit around statutory guidance for both adults and children, and then think about how you do safeguarding. What does that look like? What does that mean? What are the activities that might be recommended for you to complete in your organisation? And then there's further links available and further support from a variety of different organisations and sources that you can use kind of after this webinar. Just to introduce myself a little bit, I work for Zurich, and I, as Nick said, I'm a safeguarding risk consultant. My background is in working with charities and as a statutory children's social worker as well prior to this role. In terms of kind of the kind of the work that we kind of do, I work with a variety of different customers. Zurich has lots of charity customers, educational customers, and local authorities. So there's a variety of kind of different areas and different kind of areas of risk within different kind of customer bases and different organisational activities. But hopefully today will be a good overview. As Nick said, if you've got any questions, please pop them into the Q&A section, and we'll cover off. We'll do a Q&A section at the end of the session today. So kind of jumping into kind of safeguarding definitions and those kind of basic elements. the definitions are on the PowerPoint. Safeguarding is the ability of every adult and child to live safely, free from abuse, neglect, and exploitation, with all children needing to be protected from these harms. And some adults may be at greater risk or less able to protect themselves from harm because of their circumstances and their needs for care and support. But anybody can be at risk of abuse. So when we're kind of talking about safeguarding, it's really about taking a holistic perspective on what that means. And essentially that means that anybody that comes into contact with your organisation, including staff and volunteers, and certainly those you're supporting, need to be protected from harm. What that kind of means, obviously, kind of getting into the nitty-gritty around that can be more complex, but that's the fundamental principle, and that's kind of what is in kind of guidance and legislation in the UK. I guess the word safeguarding as well, some different language is used in different organisations. Some organisations might talk about child protection or kind of adults at risk, and we'll kind of move on to that in 1 second. But this kind of phrase safeguarding is really a much more holistic perspective, so that's quite good. It's quite good language to kind of think about the holistic sense of kind of everybody that is in the organisation and the responsibilities the organisation has to make sure that no undue kind of harm comes to them, especially from organisational activities. So kind of thinking about kind of the specific definitions, the definition of a child in England is anybody under the age of 18. There's some differences in Scotland. And safeguarding children duties apply to anybody that is coming into contact with children. In terms of kind of what that means, safeguarding is any action taken to promote the welfare of children, making sure that they're not experiencing abuse, maltreatment, making sure that their health and development is positive, and it's not being harmed. Ensuring children are growing up in safe and effective care, and then taking action kind of as required. Safeguarding adults at risk. So an adult in England is anybody aged over the age of 18 and over. But safeguarding adults at risk is a specific category. The definition is here. One of the kind of challenges that organisations can sometimes face, and it is a complex area, is knowing or understanding whether people that you're working with, volunteer staff, are adults at risk. I would suggest that from kind of my perspective, that really it's about being less worried about the specifics of whether an adult is specifically at risk, unless that information is explicitly known to you or shared by a relevant agency such as social work. But actually it's about safeguarding everybody. So an adult doesn't need to be an adult at risk in order to need to be safeguarded potentially, depending on what's happening and if there is any harm occurring to them. But this can be an area that can be quite challenging for some organisations. So if this is an area that you've got questions around, feel free to kind of put them in the chat. I wouldn't be able to kind of speak to specific organisational situations because I don't know your full situation, but it might be an area you might want to consider getting further advice on or attending further training on to look at if you're worried about this particular area. So kind of the next part would be moving on to Charity Commission expectations. The expectations are really clear, and the guidance is available online. I've linked to it in the presentation. There's notes specifically in relation to safeguarding and kind of that guidance is available for trustees as well as staff members, but it's a governance priority. It's the Charity Commission views it as an important part of ensuring that charities are completing the work they should, as they should, and it's ensuring that that public benefit and the public responsibility is being upheld, as well as kind of reputations of charities, making sure that they are they're upheld and the kind of charity sector is governed appropriately. The key part, which you may well be aware of, is that responsibilities fundamentally lie with the trustees of any charity. Those responsibilities are delegated on a day-to-day basis, with staff members or volunteers taking over roles. And some charities, smaller charities, that may not be the case. It may be the trustees doing it directly themselves, but the legal responsibilities do lie with trustees. And trustees can be held to account if things go wrong. So relevant guidance in the law must be followed. An organisation may also need to potentially refer themselves or report to the Charity Commission in the event of serious incidents, not just safeguarding. So that might be something that you need to think about if you haven't already thought about and look at the guidance around that. And just to kind of reiterate in terms of what the Charity Commission is stating, that the responsibilities are quite wide ranging. So as you can see from that list there, it's not just people who benefit directly from your work, it's staff and volunteers and any other people that come into contact through your work as well. This is a really helpful infographic that the Charity Commission you can get online. And it's just a really good summary. And what we're going to do for the rest of the session is we're going to look through some of these aspects in more detail. It just summarises the kind of 10 top kind of actions that trustees and charitable organisations need to undertake to make sure that there's good governance. Essentially, it covers off kind of policies, risk assessments and kind of risk management, and that kind of identification stage. What are the risks that your specific charity has and is working with, is managing? Making sure that there's also kind of good recognition, responses, reporting and recording. So those systems are in place to support anybody in understanding what action to take if something arises. Evaluation and kind of learning, that's a key aspect to make sure that that's being kind of fed back in. So when things potentially have gone wrong or might go wrong, how is that information being fed back into the organisation to improve kind of practice or learning. And then there's aspects such as kind of DBS checks and kind of criminal records checks, reviewing policies, and also working overseas. So that's been highlighted as a particular area, and I'll go into a little bit more on that in a couple of slides' time as well. Actually, this slide I'm going into it. So the Foreign Commonwealth and Development Office has some helpful information around the kind of aid sector and working overseas. Won't be applicable to a lot of your work, but it does come up in different some different charities kind of practices. As you may well be aware, there's been some systemic challenges in the kind of humanitarian aid sector over a number of years, and in response to that, there's been a real kind of tightening of approaches, kind of UK government intervention around that, including withdrawing funding, significant amounts of funding from major charities, and strengthening their approach, their requests, to charities around safeguarding to make sure that things are safer than they were previously. There's some good resources available out there, which again I've linked to through the presentation, that you might want to look at. One, if some of your work does touch any overseas work, but also even if it doesn't, there's some really good resource available to support organisations that are applicable in the UK as well. So just want to kind of cover this off. May well kind of already have this information, but it's good just to as a kind of essentials webinar to make sure that it's kind of covered. It's really about the statutory guidance for children and adults at risk. So the Working Together to Safeguard Children guidance is clear that voluntary organisations, charitable organisations, as well as private sector organisations, so essentially everybody, has an important role to play in safeguarding children. It's not just it's not a sole responsibility of social work or a local authority or schools to undertake safeguarding actions. It's all organisations, and those responsibilities exist. As you can kind of see from what I have on the slide, there again there's kind of specific requests such as policies being in place, systems to ensure that reporting can happen, and that also there's checks and balances around quality and compliance. That there is training and knowing how to refer onwards if necessary. Particularly highlighted there is referrals to local authority, children's social care or the police, but other agencies potentially as well. The other aspect that if your organisation is working with children and an allegation is made about one of your staff or volunteers, and those people are working with children, that needs to be responded to and potentially shared with the local authority, depending on the details of those that allegation. I would always err on the side of caution and developing good relationships, attending local training with your local authority, having communication with LADO, the local authority designated officer, who responds to allegations about people who are working with children, is a really helpful thing, and kind of running things by them. Obviously, it depends on your specific circumstances and what you're working within and how much your contact with children includes. But there's responsibilities to do that and to pass that information on and share it. There's also within the kind of Care Act statute guidance, there's also mention of voluntary organisations within that, and on a similar kind of similar way to the children's guidance. So there's responsibilities on voluntary organisations, and there's responsibilities around acting if there's allegations made against people in a position of trust with adults as well, and what that might look like. Okay. So the next part of the webinar will look at safeguarding cycle. And what I mean by that is how you do safeguarding. What does that mean? What are the actions kind of taking place? What do you do within your organisation to take tangible and kind of clear steps to to improve the way that you're doing safeguarding, or consider it? So this is a kind of helpful model to think about the various different areas that your organisation may well need to think about. The first aspect is about identifying. So what we're talking about there is essentially a risk assessment, risk management approach for your organisation. So what are the risks that you hold? What are your activities? When do you come into contact with children? How do you come into contact with children? Do you knowingly have adults at risk, or and if you don't, you have adults that you work with, what potentially are their needs, and are there any risks associated for them or with them, and thinking about how your organisation interacts with people in all ways, shapes and form, and that's not just face to face, that's also online. That's really the kind of, I guess, a kind of review stage, a kind of risk assessment stage for the organisation. And then from that, you can then develop prevention approaches, which are really, really key, really important. It's not enough to just jump to kind of being responsive. So you need to have some level of prevention in place to try and reduce the incidence or possibility of harm within your organisation, rather than just waiting and responding when one potentially comes up. From that, you also need to think about the reporting. If and when there are concerns, how is that being done? What are the pathways for individuals to do that? What helps to support individuals in reporting and reduces the barriers to reporting? Thinking about then the next part is, how's the organisation responding to those reports? You could have lots of really good quality reports, but if the organisational response is poor, how are you going to manage that, and the kind of implications around that? And then the last stage is about the learning. So that's kind of, again, I mentioned that earlier about the Charity Commission needing that feedback loop into the system. And this is a constant. The idea is that this would be a constant cycle that the organisation is rotating round. It's not a one-time piece of work that is then done. It's a regular ongoing um, area area of consideration for everybody within the organisation to a certain degree, but obviously kind of trustees' responsibilities and maybe designated safeguarding leads or designated kind of staff members who have specialist knowledge or kind of have been designated that responsibility need to consider this kind of as they go. Every organisation has more to do and more to learn, and there's gaps in every organisation. And unfortunately, sometimes you only discover those gaps when potentially an incident has taken place. And that's why having a kind of learning culture and a kind of continuous improvement culture is really, really important. Um, I guess just to kind of touch on as well, and this will kind of come up frequently, I'm going to mention the word culture. Um, there's, in terms of the evidence base around institutional abuse, organisational abuse, there's various things that we can learn from things that have happened previously, and the research base is a really interesting thing to kind of go through. But a really fundamental key aspect is around culture that often comes up in reviews, and your ability as an organisation to take this seriously. And kind of make considered, thoughtful decisions that um, work to protect people and kind of reduce harm and kind of rectify any situation that potentially has occurred and make people as safe as you can is that's what you need. You need that culture to exist. It's not a tick box exercise, and we know that when organisations treat it as such, then that's often organisations that then think things are more likely to go wrong in. And there are obviously significant repercussions in a variety of different areas. The reputation of the charity, potential charity commission concerns, potentially legal, criminal or civil concerns in major cases that we're looking at. It is important, but I also don't want to kind of panic anybody by saying that, you know, I think it's also about kind of being proportionate to what the organisation does. And many of your organisations are small charities with kind of limited resources. So it's about thinking strategically and thoughtfully about what works for your organisation, which is why safeguarding, unfortunately, isn't a kind of one size fits all. It's very, very bespoke for what you need. So just going into these a little bit more in a little bit more detail. Um, the first kind of aspect around identification, I've already talked through a bit. So that's the risk assessments using kind of risk management framework. It's important to have staff and volunteers feeding into the process. So if you don't know what your risks are, how can you manage them? And often you know, senior managers or trustees who are kind of potentially, they may not be in your organisation, but some organisations are some steps away from the operational risks that the kind of day-to-day that the charity is managing. So having staff and volunteers kind of input into thinking about what those risks might be, where those gaps might be, as well as the strengths that the organisation is working to. So it's important to identify the strengths, to know those, and to make sure that that good practice is continued and maybe not taken for granted as well. Is a really, really important kind of part. And it obviously further helps kind of just the kind of change process, if there are further changes down the line around implementing safeguarding training or policies, having buy-in from staff and volunteers at an early point, and ensuring that their voices are heard, is really, really helpful. There should be a designated safeguarding lead for your charity and a trustee with the responsibility as well. Um, and as I've kind of said there, it's best practice for a senior manager to be the point of contact to manage allegations against staff or volunteers. Um, Depends on your organisation, however, and kind of the activities that you're undertaking, but that would be a kind of general advice. I mentioned earlier that it's not just face to face; it's also online responsibilities, and the Charity Commission is clear on that. Um, yeah, you need to keep people safe online, and you need to kind of reflect that in your policies and practices, and you need to think about your presence online, as well as how people are interacting with you online and the spaces that you are creating. So the second aspect, the second kind of part of the safeguarding cycle around prevention, policies and procedures have a really key role to play here. Clear policies that are direct, that give detailed information about what to look for, how to report. Is really important to make sure that there's kind of clear guidelines, and obviously the kind of basics of ensuring that all staff and volunteers have read these policies as well. I think that's an area we see sometimes, that an organisation might have great policies and procedures, but nobody knows what they are because they haven't read them. So that's an important step to make sure that that's completed by an organisation, particularly at the start of and a staff member starting in post, or a volunteer starting with you. It's kind of, again, kind of recommended that you would have a safeguarding policy, then associated procedure, so safeguarding policy, potentially more kind of general and shorter, and then more detailed procedures. That could be in one, but it can become quite a lengthy document depending on what risks you're managing, and what you need to cover off in that. So separating them is sometimes helpful, and a code of conduct, that's beyond safeguarding, but it helps to kind of govern behaviour expectations, and tells people what they can expect from your organisation, from your charity, and what they can expect from those that are representing your charity. There's lots of other policies that really intertwine with safeguarding. So, and the Charity Commission is specific on some of those. So kind of health and safety, digital safety, given the kind of online world aspect, disciplinary policies, bullying, harassment, and whistleblowing as well. One of the things I think quite a lot about with different organisations is particularly around whistleblowing, making sure that there's good, robust approaches in place there, that they make sense, that they fit for the organisation. Yeah, in terms of kind of giving an alternative reporting route for anybody who might have concerns, it's an important thing to consider. How is that done effectively in your organisation, and what might be the barriers for whistleblowers coming forward. There should be regular reviewing of these policies, and the Charity Commission is clear on that. This should be kind of reviewed following a serious incident, and at least once a year. To regular updating of so that we know that they're live documents. Changes in legislation happen, changes in language happen. Just to kind of go back to when we're talking about adults at risk, there previously some language that was used in statutory guidance was the term vulnerable adult. You still quite often see that in various different policies and procedures, but that is now outdated language, and isn't represented in the legislation and the guidance. So things like that have moved on. So policies and procedures also need to kind of move on, and use the kind of most relevant and applicable legislation that relates to the areas that you're working in. Obviously, you need to also think about, we're focused on England today, but if you're working in any of the other nations, you need to think about some of that legislation. In particular, Scotland has different legislation and different definitions of a child also. The policies that you need to kind of write also need to consider the range of activities that your charity operates. And I think one of the things that sometimes can be forgotten in those is like ad hoc events. And thinking about if those need to be within specific policies, or are mentioned in brief, and kind of the risk assessments around that. This documentation is important, and is really helpful in kind of thinking about kind of that aspect of prevention. Training really key element, should be provided to all staff and volunteers relevant to the role and responsibility in the organisation. And that would be up to you to decide what feels applicable for your organisation. However, basic training in safeguarding is encouraged for everybody, I would say. And if you're a manager with further responsibility, potentially managing allegations responsibilities, or you're a trustee, you may want to undertake other specialist training to think about how that applies in your organisation, what you can take from that for your specific cases, and potentially also linking in with other kind of networks and resources around you, and other charities that maybe work in a similar way to you. Kind of peer learning and training is really, really important. And as I say, some of the legislation changes, language changes, thinking changes, and new research comes out as well. So keeping up to date with that is helpful. And again, kind of, I think I've mentioned that a few times now, and I probably will say it a few times more before the end of this webinar, is that the training needs to include kind of lessons learned. So that feedback loop of learning, going back into the organisation is a really, really important element. Another kind of clear aspect of prevention is about safer recruitment. This comes up quite a lot. I get quite a lot of questions around this, thinking about kind of, when people are being recruited into the organisation, how is that done? I would just to kind of share a perspective around this. I think sometimes organisations can that I'm aware of can sometimes think that this is a kind of main prevention tool, as if you stop somebody who may have a criminal history from getting into the organisation, then that's kind of prevention kind of done. And I would say that's one small piece of a very big puzzle around prevention. There's legal responsibilities to make sure that your staff and volunteers are not on the barred list for working with adults at risk or children, and that's a responsibility that the organisation holds. So in order to make sure that you're adhering to that, and you're not, you haven't recruited people who are on the barred list, you need to think about criminal records checks through the Disclosure and Barring Service. But beyond that, there's lots of other approaches within safer recruitment. They can help you recruit the right people with the right approach, the right ethos, values, skills, to complete their role, and help to keep your organisation safe, and those you work with safe. It's really a kind of continuous process. So at the front door, when staff start in post, or volunteers start in post, there's the safer recruitment at that point. But it's also an ongoing process through those staff and volunteers' involvement with the organisation through supervision and kind of whilst they're with you. There's other kind of practical, there's some good training that's available and that's specific around safer recruitment that you can access, that might be something that your organisation wants to undertake, or have somebody attend to think about some more of the detail around this, because there's things such as making sure that references are fully received, and kind of checks on gaps in work history. There's been some significant cases. The reason that this advice is given is because of cases that we know where this has not happened, and things have fallen through the net. Gaps in work history are checked because there have been cases where that hasn't been checked, and people have later been found to have spent time in prison for offences, and have failed to disclose that, and it hasn't been found through other checks and balances. For example, if that person was in prison overseas, and so that wouldn't appear on a DBS check, and because there was a gap in the work history and that wasn't checked or confirmed, why that was the case, that wasn't known to the organisation, and then incidents occurred from that. So everything that's here is come from learning that we have in the sector, of knowing that these things are are problems that have happened for other organisations. Overseas checks should also, just kind of picking up on the example I just gave, overseas checks should also be made available. Should also be made. However, it can be a complex area, and that may be a proportionate kind of assessment of risk that your organisation makes around how much you do, how much resource is put into those checks, because in certain contexts it may be challenging to get information, but there's further guidance available around that. If that's a particular area of risk for your organisation, I suggest you get some further detailed advice and support. The next area is around of the safeguarding cycle is about reporting. So this is where culture comes into play a lot, as does the prevention area too. It's about making sure that your organisation promotes an environment where people are comfortable at speaking out if something is worrying them. There's protecting people, safeguarding is discussed regularly in supervisions and team meetings, um, at board level, so board meetings, a regular standing item. Making sure that there's good reporting mechanisms, and what those look like again in your organisation may look differently from another organisation. But it one of the better aspects, if it's possible for you to resource this, is some kind of independent within the organisation, but some kind of reporting structure where you could potentially go to a more independent person, or somebody that is less connected to the work that you're completing, or the kind of area that you're in. So that's something to consider if it's possible to do that in your organisation, having reporting mechanisms and structures that don't just rely on kind of traditional kind of hierarchical structures, and that people are discouraged from stepping outside of that hierarchy. We also know that from research that particularly hierarchical organisations can be at risk of increased risk of institutional abuse taking place, because of that kind of culture of reporting to only one person who then reports to another person, and etc. And an organisation that is more a fluid, flexible culture, where anybody can raise anything with any manager, for example, is better practice. We know that that's more effective. Really trying to think through what specific barriers exist in your organisation. Why would somebody not report? What would put them off? And there's the general barriers that exist in every organisation, but what is specific about your organisation? And I think that's quite a um challenging thing to think about sometimes. But having honest conversations with your volunteers, your staff, your trustees, being critical friends to each other, challenging each other, and really trying to think that through, and then making sure that the reporting structures try to remove as many of those barriers as possible is really important. Good supervision, reflective practice, for staff and volunteers, bringing up safeguarding, having a standing item on every meeting, um, is helpful. An area of that we talk about in policies and procedures is about reporting low-level concerns, and there's some guidance available on that if you want to look further into that. And what we mean by that is not that there's been a staff member may not, or volunteer may not have seen something explicit that has clearly been a kind of safeguarding concern, but there's something that doesn't feel right. They have a gut feeling, there's something that doesn't quite sit, there's some things that are maybe fitting together that are causing them some concern, but they haven't got anything that they certainly would think would reach a police level, for example. Again, we know that organisations that take those concerns seriously at an early stage and deal with them carefully and sensitively, um, and with the right to for the person who there may be an allegation about or concerns about, kind of working with that person to kind of address what those concerns be. It may be as simple as a lack of training in a particular area, a different approach, a different kind of style, but being able to navigate that with them and being open and honest that potentially some concerns have been raised, things have been noticed, and supporting them to kind of respond to that piece of feedback is really helpful. We know that kind of organisations that don't keep those records can often, when subsequently events happen and subsequent investigations are undertaken, often things were known about in various places in an organisation. Information was held by various different people. Incidents have happened, smaller incidents often that didn't reach a threshold. According to the organisation, to be recorded centrally, or kind of formally kind of dealt with. Therefore, but actually, at the end point where there has been some clear harm, which has kind of ended in a significant investigation, we can see that it was known about. That kind of open secret, or kind of, well, I reported it, nothing happened, so I didn't report it again, and then multiple other people have done that, and people aren't talking to each other. Understandably, that wouldn't happen, and you wouldn't want to encourage that, you know, kind of gossiping about colleagues, but that information then gets lost, and actually there is harm occurring somewhere. So thinking about that low level concerns, and it's a complex area again to think about how you manage that with HR policies and protecting everybody involved, and making sure allegations are dealt with appropriately and fairly. But there is guidance, and it's something that the organisations that do safeguarding well do. As I mentioned earlier, the Charity Commission requires charities to report serious incidents. And this responsibility lies with the charities trustees, but may be delegated. And I've got the list of or a list of some areas that would be relevant for reporting serious incidents. So safeguarding is on there, under the harm to your charity's beneficiaries, staff, volunteers, or others who come into contact with your charity through its work. So that may be something you would need to report on to Charity Commission. In terms of kind of thinking about responding to the allegations or reports that have been made to you and the concerns that have been raised, if you think a child is in immediate danger, the police must be called on 999. There are a variety, so many different combinations of possible responses to an allegation or an incident. Every safeguarding situation, every safeguarding alert, report, allegation is different. There's some general principles that those who are kind of experienced safeguarding professionals managing those incidents will be used to, but every situation is distinct and different with different individuals. But there's a few areas that would, you know, need to be considered: whether the police are investigating a possible criminal offence, whether the local authority, so that the LADO, or you kind of local authority child protection services, are making inquiries or assessing any kind of needs, and the LADO would be the contact for that. And then also about your organisation's own disciplinary procedures, because just if something may not be a safeguarding incident that meets a threshold for police involvement or potentially even LADO involvement, but they will, you may still be undertaking disciplinary action against that person for whatever reasons. So it's about, in terms of thinking about the responses, I guess I wish I could be more specific around, and if this happens, then this is what you should do. The reality is it's such a complex area that would be really unhelpful guidance and potentially quite harmful guidance. But it is for your organisation to sit down and think about what your specific risks are, what's realistic, what's proportionate as well. So what's the real level of risk that you have, and thinking about what would be an appropriate response in that situation. As many appropriate heads around the table thinking about that, so that the correct people being involved in that decision making is really helpful. Safeguarding is really hard to do alone. It's something that is much more, the quality of responses are much more improved when there's more people thinking things through together and thinking about the possibilities and the various different elements. That's how local authority, statutory children's social work and adult social work is run. Multi-agency approaches, bringing different perspectives, making sure that there's kind of shared decision making and collaborative partnership working. And that should be similar within your charities. It shouldn't be something that one single person has absolute responsibility for and is making some potentially big, challenging, complex decisions around. There needs to be support for that person, and with the right people having knowledge of the incidents. Confidentiality really important, and managing that appropriately. Not just for police investigations, but obviously for the safety of the person who there may be an allegation about as well, and the responsibilities of keeping them safe and kind of workplace wider kind of HR processes can support that to make sure that they are supported whilst investigations are being undertaken. In terms of regulated activities and work with children, there you have the organisation has a legal duty to refer anybody who's left your organisation to or moved into a role which does not involve regulated activity. They need to be reported to the relevant disclosure and barring agency. So in England that would be the DBS service. And if you fail to do it, it is a criminal offence. So if you're uncertain, if there's any kind of uncertainty around that, I would suggest you gain further advice at the time in response to the specific incident or the specific kind of allegation. Essentially, this is to stop because again we've learned over time that this has happened in previous in other organisations. This is to stop when a safeguarding allegation has been raised and the person has resigned and moved on to a different role, and the first organisation has then halted their investigation, not continued the investigation, and passed on no information to subsequent employers. The recommendation is that that safeguarding investigation would be completed even after the staff member has left, and that would then influence references. You would kind of look to your kind of various other HR processes to manage that and think about that. But that you need to, if DBSs and regulated activity is being undertaken with children, you need to refer that on to the DBS because they need to know that information. Record keeping is also very important. Again, learning from other organisational, institutional cases of abuse. It's, as I mentioned earlier, about the kind of low-level concerns, for example. Things are often not written down, often not stored. And so thinking about how that information is kept, thinking about keeping records of the discussions made to understand the decision making that was taken, and why certain decisions were taken and certain actions were taken and why others were not, is very important. And then finally, we have the last part of the kind of the cycle around learning. The Charity Commission does specifically advise that there should be a standing item on trustee meetings around safeguarding. Reviews should be disseminated to staff, and learning should be part of a variety of different kind of processes in the organisation, feeding into training, as well as kind of getting feedback from staff and volunteers, or kind of passing that information on to them. Learning should be seen as a continuous process rather than just a simple kind of one-off event in the organisation. And that's the end of the webinar for now. So the last few slides I have are areas of further support. So there's a couple of pages of links and resources, some really helpful sources of information. Just to kind of highlight a couple of things, NSPCC, excellent resources for working with children. They have some helpful guidance, including a self-assessment tool. and the Ancraft Trust, who work with adults, have a similar safeguarding checklist that you can use as well to help you think about your organisation's that very initial stage of identifying what the risks might be. Lots of tips for writing policies, explaining terminology, kind of highlighting the various different pieces of legislation as well, and some really good resources from NCVO, the Charity Commission guidance, as well as some of the other guidance I mentioned about working overseas, where there's some helpful things that are applicable to the UK also. So thank you so much for your time. Then we're going to move on to questions now.
We are indeed. Alex, thank you so much. That was so thorough. So much kind of content in there. But can I take a breather for now? And I can just do a quick kind of introduction to NCVO membership. Also, if you've got any questions that you'd like to put to Alex, please feel free to pop them into the Q&A function, which you can access from the bottom of your screen. Between kind of Chanel and I, we've answered 7 so far, kind of directing people to further information on the NCVO website. And so we've kind of posted links into those questions that we've answered, and we'll make sure that we kind of extract all those links and we'll put them into the follow-up email that we'll send shortly after today's webinar, so that everyone has got access to them and you can have got that kind of signposting to hand. But Alex, if you want to have a kind of quick scan through the questions that we have received so far, and then we'll come on to them in just a moment. But I just wanted to highlight that if you're not yet a member of NCVO, we'd love to welcome you into our community of 17,000 organisations, from the biggest household name charities to the smallest community groups. Now, 70% of our members have free membership, so that means that they've got a turnover of kind of £30,000 or under each year, and 90% of our members are small with a turnover of under £1 million. So do take a look at our many member benefits, from 30% off our hugely popular training courses to the huge number of downloadable tools and templates that are held behind the member paywall that will help save you time and money so that you can focus on the things that really matter. We'll be including this slide in the follow-up email that we send. But if you've got any questions about kind of NCVO membership, please feel free to reach out to our membership team by emailing membership@ncvo.org.uk. But Alex, perhaps if we kind of start off with 2 kind of the short kind of questions, one around kind of trustees and safeguarding leads, and the other round about terminology of vulnerable adults. So kind of first up, can a trustee also be the safeguarding lead? So does there have to be a trustee for safeguarding versus like a designated a designated safeguarding lead, or can they be the same person?
Yeah, so I think that's a really good question. I'm making a bit of an assumption from that question that potentially your organisation might be quite small. I unfortunately, and I suspect with some of these questions I might not be able to give you such specific an answer because I don't know enough about your specific organisation. Best practices, it wouldn't be the case that a trustee is also the safeguarding lead. But I'm conscious that I don't know the size of your organisation and what the scope of your activities are. So it would be difficult to kind of answer that. The reason why it wouldn't be best practice is you want critical friends and you want checks and balances in place. So like I was kind of talking through at the end there about it's as a safeguarding professional myself, having to make some quite challenging decisions around the safety of others. I could never have done that in isolation. I can't do it in isolation. It's a really challenging work, challenging work to do, and you don't know what you don't know. So it's really through conversations with others people's perspectives, experiences, knowledge bases, or even just seeing a situation in a slightly different way to you, potentially in a riskier way, potentially in a less riskier way, and kind of thinking through those thresholds of what would be applicable, what would be fair, what would be the right response. Is why I would be worried about a trustee being the lead, the kind of operational lead for safeguarding, as well as the trustee lead. It really would be absolutely best practice for it to be separated. But I am conscious, I don't know the scale of your organisation and what risk you're working with, and also kind of why why that might be required. So yeah, I would potentially look at that in a little bit more detail. Yeah.
Perfect, thank you. And then also kind of on the NCVO website, we've kind of got a list of the roles and responsibility, or the responsibilities for a dedicated safeguarding lead versus the kind of trustee lead for safeguarding. So they're kind of like two separate kind of web pages that we'll include in the email that we send shortly after today's webinar. And then, Alex, what's kind of the correct kind of terminology that people should be using for vulnerable adults in their kind of policies?
So, apologies, that was probably me not being very clear with that in my presentation. So yeah, the kind of the older kind of language, as the person has picked up correctly, is a kind of vulnerable adult language. It would depend on your situation. So if you're looking at adults, in general, so it's just safeguarding adults, it would be safeguarding adults, it would just be adults as a language. If you're looking at people who you believe are adults at risk, so under that legal definition, the statutory definition, it would be adults at risk is the new term. The vulnerable adult term has been replaced by adults at risk. That was because of feedback from disability campaigners, that the term vulnerable adults feels is experienced as disempowering, and doesn't fit their kind of experiences, and people could be potentially adults at risk at a particular point in time in a particular area, but not in other areas of their life and not at other points in their life. So it's a very fluid definition, which is why some charities, I would say it's a challenging area, and I would be very I would really agree that it's a complex area with children. Obviously, the age is a very straightforward definition that you everybody understands, but knowing if somebody is an adult at risk. So I would urge people to move away from worrying too much about focusing on the narrow adults at risk, and I would just focus about protecting people. If I was accessing a service from a charity, I might not be defined as an adult at risk at that point of accessing that service, but I would still want to be protected whilst I'm involved with that charity. So that's how I would kind of view it. I'd take that more holistic view and worry less about the kind of the narrower, kind of more complex legal perspective around adults at risk. But if you are using kind of that language, it would be adults at risk as opposed to the vulnerable adults.
Fab, thanks for clarifying. And then we've got a question from Robert, who that they run a small rural village hall, and they're kind of wondering about the kind of the reporting aspect of their safeguarding cycle. And who would you expect to see in the kind of the escalation if an incident did occur kind of at the village hall that something was observed? When you're thinking about like statutory kind of organisations, would you imagine you report to the police? And if so, kind of who else would you need to raise any concerns with?
Yeah, so I think again that's a good question. It is quite a specific question, so I'll hopefully be as helpful as I can in my answer, but I'm conscious that I don't want to make assumptions that are incorrect. Um, in terms of, I would need to, so I would have kind of further questions for Robert around this, around asking what activities are undertaken in the village hall, who's accessing it, under kind of what's kind of circumstances they're accessing it. Um, I actually myself grew up in a very small place where village halls were a kind of feature of my community that I grew up in. And I guess one of the aspects I would be curious about is kind of what knowledge exists. So is the village hall aware of any risks specifically that they should be concerned about, that they've been informed of by people, because that would be relevant if actually there's been kind of flags raised, reports raised about an individual or a particular situation, and that's kind of known about in the community, or kind of shared with them, that might potentially change the action that they need to take. Whereas if it's a new piece of information, something that's unknown, and they is genuinely a kind of new incident. So I think, unfortunately, I wouldn't be able to kind of be specific about where the potential reports would be made. But yes, the kind of what Robert has mentioned about maybe police reports might need to be made, and also social work, depending on what has kind of happened. Um, it also depends as an organisation how involved you are with your group of beneficiaries. Are you an organisation that would do onward referrals to other charities for support, for example? Would you support an individual with attending a GP or a health appointment or doing a referral to a health service? Lots of charities do that work. They do that support work. It's part of their day-to-day practice. So if that is something that you're doing already, because that's part of the work that you deliver to people, then you may want to also liaise with any of those organisations that you know are part of that person's life. But as I'm that this is why it can be quite challenging to answer some of the specific questions, because I don't know the full extent of exactly the activities that would be kind of undertaken, and the kind of full context. So unfortunately, maybe not a very helpful answer, but definitely police and social work would be a potential route for referrals if needed. I would say that, I guess, just to say that a small rural village hall should still have a safeguarding approach. They should have a policy of some kind. It may not be the biggest policy in the world. It may be quite brief. It may have some quite straightforward reporting structures and kind of follow-up actions that would be taken. It doesn't need it needs proportionality is important, as I've said, but it is still a charity that's involved with working with members of the public, that's coming into contact with a variety of people, including children. So there does need to be an element of safeguarding considered, even if it's viewed that it would be unlikely. One of the things kind of in general as well, with safeguarding, that's a big part of my world, is that, quite frankly, when we're looking at kind of organizational abuse, safeguarding is less common. It doesn't happen. Safeguarding incidents don't happen depending on the organization's specific activities. Safeguarding happens, and kind of specifically kind of major, the kind of scandals you maybe see in the press. They don't happen every day, but when they do happen, they are devastating to the charity. There are huge impacts on their functioning, on their operations, on their reputation, potential legal risks, criminal risks. So I guess it's about balancing the probability versus the impact, because just because it's got a low probability of happening, if it does happen, it could have a devastating impact on your organization, let alone the person who's been harmed as well.
Thanks, Alex. And I think a link to that, there was kind of a question around, so like running a village hall, which is kind of generally kind of led and kind of managed by like a team of kind of volunteers who make up the committee. What would be the kind of like the minimum requirements you would expect to see in terms of kind of policies and procedures? And for really small organizations led by volunteers, or perhaps just with like kind of 1 to 3 staff members, how do you start to kind of embed these safeguarding procedures into your kind of day-to-day working? Have you got any kind of tips or advice for that?
Um, so yes, I'm just having a look. I think it was that one of those questions from Claire. Was that
From
one of
Claire,
those about the
yeah,
village
just
hall?
above that
Yeah,
was the Midland Trust around kind of
yeah.
embedding safeguarding procedures in very small organisations.
Yeah. So I mean, I guess I'm quite struck by the fact that Claire has mentioned that they have been asked for safeguarding policies when applying for grants. This is definitely not uncommon. It's an increasing, safeguarding is only increasing within organisations, and funding bodies and are looking for those policies, procedures, approaches, being embedded much more. So there are expectations around that. Um, Again, unfortunately, because I would need to really kind of consider the kind of the details of kind of each case independently, and think about what that looks like. But my general advice would be that there should be policies and procedures. How detailed those are, how complex, and the kind of level of proportionality is up to you to kind of work out as an organization. But the basics would be that those things exist. Um, and there's no, just because an organization is run by volunteers, it doesn't mean that the legal requirements and the expectations from the Charity Commission, and the various other guidance and other legislation, for example, around working together with children, um, doesn't apply to you. It still applies to you. If the organisation, just because it's run by volunteers, it doesn't kind of negate that. I would suggest that if one of the things you might want to consider as an organisation is, if you're struggling to maybe know how to navigate some of this, and you think it is relevant to your organisation, you could look to recruit volunteers who have specific experience of volunteering, of safeguarding, and have that kind of specialist input in a similar way that charities and organisations would look to have specialists around finance or around kind of HR processes or marketing, for example. There's a whole variety of different skill sets that charities are looking to get volunteers in who have those skills. So safeguarding may well be something that you want to kind of recruit for special in a specialist way. I do think there sometimes can be a bit of a tendency because safeguarding feels in some organisations maybe feels like it's a bit of a tick box or it's less relevant, that there's maybe a thought that kind of general that kind of anybody can do it and anybody can safeguard. But if you've got concerns about the more kind of professional expertise around it, and you would like more to feel more secure as an organisation that you're doing things in the right way, or you have staff or volunteers who have experience and skills in that, I would suggest you potentially recruit for that and try to identify those people who could support you on an ongoing basis. Um, yeah, did I answer the question, Nick? I think the second one I maybe didn't answer quite as well, but if there was anything there that you thought I should expand on.
I think that's okay. If anyone wanted to kind of pop a follow-up kind of question into the Q&A, please feel free to. But there was a couple of questions, one from Alison and one from Raina at the top, just around kind of working with and supporting kind of vulnerable adults maybe who are living independently, but who may be kind of at risk of financial abuse. Where does this kind of fall in terms of like escalating kind of concerns, or what would you expect to see in terms of kind of like risk assessments if these scenarios were to occur?
Um, so I would need to know, I need to know again quite a lot more information about what the concerns would be and what the charity's kind of involvement is with the person. If you're a member of the public who has concerns about somebody being financially abused, you would very likely take different actions to if you were a charity who was working directly with that person, providing some kind of support, for example. So I think in that situation that it would have to be you mentioned kind of risk assessments next, so it would the charity themselves would need to do a risk assessment around what those risks are, and how they're involved in those risks, what information they're holding, where their responsibility lies. Unfortunately, I'm not sure because I don't know what the organisation does. So it would be challenging to kind of give advice on that. The Anne Craft Trust has some really good resources around safeguarding adults. So that maybe an avenue you'd like to go down to get further advice from them. Um, and fundamentally, you could call the police in terms or speak to the police on 101, a non-emergency call, if you had, significant concerns, or kind of worries, and you could also call social work as well. Again, kind of as a non kind of emergency kind of referral, to ask their advice if you thought that there was somebody being significantly abused. Given kind of I wouldn't want to kind of advise that those are absolutely the right steps in this very specific case because I don't know the specifics of it, but calls to social work and calls to the police if you felt that was kind of appropriate, where would potentially be good options.
Thank you. And it's so kind of tricky in this kind of circumstance where you don't get to have a two-way conversation with the people who are asking the
Yeah,
questions. So I
yeah.
hope I'm doing them justice. And then we had a couple of questions around DBS checks. So someone said that the only kind of person in the organisation who comes into contact with service users is their delivery driver. Someone else said trustees don't have any kind of day-to-day kind of contact with service users at all. But to what extent do you need to kind of, should those different kind of types of people, delivery drivers, trustees, go through a DBS check-in process? And are you aware of kind of like anywhere where people can access a list of like certain roles or activities that do need to be kind of regulated activities that should be DBS checked against?
So again, it would be about contacting the DBS service for that. There are some resources. I've got some links on the further support pages around looking at DBS resources, and they have some good outreach services, and they have a phone line that you can call and contact to get further advice on whether your staff members or your volunteers would meet the kind of requirement for it. DBS is extremely complicated, and again, apologies for the challenges of me not being able to give you specific advice, but this is an area that I absolutely don't give advice on because I don't know enough about the individual details of the role. And it's very specifically a legal responsibility that lies with the trustees. So it is important to get right. But the best place to go for that information would be direct to the DBS service. It is about being proportionate. Just to say a few things around it, it is about being proportionate. So it's also not legal to undertake DBS checks when it's not relevant to do that. So you can't just do DBS checks on people that actually aren't undertaking work that require DBS checks. You can have, because that would be sharing incredibly sensitive information about individuals, and you would need to then also store that information, keep that information confidential, manage that information. So there's kind of repercussions of that. But the main thing, the best kind of port of call would be to contact DBS if you're unsure of kind of what that would look like. You can also have basic checks as well. There's a different level of DBS checks, so you potentially might want to look at whether basic checks would be applicable rather than the checks for people undertaking regulated activities. And when I was kind of talking about kind of when you're responding to an incident, record keeping really important. Record keeping around this is really important. So why are decisions being made? Board of trustee decision making, minutes for kind of trustee board meetings, minutes of working group meetings, for example, around this. It should be a group responsibility rather than one person making an individual decision on a DBS, or kind of a role needing a DBS. But it is something that an organisation should take seriously, because if somebody is on the barred list and then is doing regulated work with children or with adults, then there are consequences around that.
Amazing. Thank you so much, Alex. I literally think that's probably all we've got time for in terms of the Q&A, and that was a quick fire round. So thank you for kind of getting through so many questions. And much of what Alex is going to mention, a reference, like we've got some slides here that can offer further advice and support. So there's a whole kind of safeguarding section on the NCVO website, which includes topics such as kind of getting started with safeguarding, steps to safer organisations, safeguarding the law, and then there's guidance for specific aspects of safeguarding, specific activities, and for specific roles. Plus, we've got 3 online training courses ranging from the half-day session Safeguarding Essentials for Trustees to the full-day Safeguarding Essentials in Charities and the hugely popular Designated Safeguarding Lead in Charities. Remember that NCVO members can get a 30% discount on all training places, and we'll be including links to these training courses and those kind of website areas in the follow-up email. For any questions that you can't find the answers to online, NCVO has a free helpline for small charities. So you can scan the QR code on this slide to find the details of how to contact them, and contact details will also be shared in the follow-up email. We also reference a lot about kind of DBS checks. So as kind of Alex mentioned, the DBS has an outreach service, and you can contact your local DBS regional outreach advisor, who can answer DBS related queries, providing advice via phone and email. And they can help organisations and networks to understand what levels of DBS checks can be applied for and what information these checks will provide. Of course, today's webinar wouldn't have been possible without the support of our trusted suppliers, Zurich, who provide insurance for charities, social enterprises, and community groups of all shapes and sizes. They offer a fixed package for organisations with an income under £300,000, where cover includes a £5 million public liability, including cover for volunteers, personal accident, and up to £10 million for employees' liability. So the QR code that's on screen will take you to further information about how Zurich can help and support your organisation. In our final minute together, any second now, a snap poll will appear on your screen to get your initial thoughts on how you found today's webinar. And if you've got time, we also have a short feedback survey, which will appear in your browser as you leave the Zoom call, where you can give feedback on the things that were helpful, what you'd like more information on, and most importantly, where we could make improvements. So I hope the last hour and a quarter has been useful, and you've got a list of all the things you want to do and the conversations that you need to have at your own organisations. But a huge thanks to Alex for guiding us through the last hour and a quarter and for answering all of your questions. And thanks to all of you as well for joining our webinar this morning in partnership with Zurich. Until next time, take care, and we hope to see you again soon.